Flexibility might be something like a toe touch test. You know, how close can you get range of motion in your hamstrings? You know, that strikes me as flexibility, and the evidence on that is that it's fairly static. You know, people can do loads of stretching, but as soon as they start stretching, the hamstrings go back to normal. And I suppose the way I think about it is thought about like that, flexibility isolates the muscle away from the brain, so it's not thinking about the brain to control the muscle. So I don't like it as a basic idea. Mobility, I start thinking more about quality of movement. Yeah. So the ability to touch my toes briskly, as opposed to taking 3 or 4 seconds to bend over and creak down and touch my toes.
So sort of the ease of movement.
Ease of movement. Yeah, the quality. Do I look stiff when I do it, or do I look soft? That's important, because that's the brain controlling the movement. When people are in fear of hurting themselves, they tend to be stiff, and when people are moving really well, they will move much softer.
So you want more of an unconscious movement for that?
Well, what I want is, quite often the stiff movements are unconscious. Well, they'll start consciously, people start bracing because they're fearful of pain, but 10, 15 years down the line, they'll be doing it subconsciously. And that's really interesting. When you point it out to people, they go, bloody hell, I didn't even realise I was doing that. Yeah, it's happens all the time that people will come in and I'll say, go on and let's see you bend forward. And they'll be really stiff, and I'll just ask them to tuck their chin to their chest and curl as they go down, and all of a sudden they've got a much better range of motion, and they think,
how did that happen?
It's almost like they've forgotten how to move.
I think the thing that I've noticed as well is that people can't figure out how to move certain parts.
Yes.
It's always because it's not, say, a day-to-day movement. So say with the pelvic tilts, and you say, can you do this? And you can almost see the cogs going around and them thinking, oh, how do I create that movement?
Perfect. That is a really good idea, and something that I think about a lot is this disconnected phenomenon where people, don't seem to be connected with their body. And what this comes out. Do you know what a homunculus is?
No.
So homunculus is the map on the brain of the body.
Right.
So, and there's a motor homunculus and a sensory homunculus. And if we think about the motor homunculus, what that means is that if we stimulate specific parts of the brain, we could stimulate a part for my quadricep.
Yeah.
We could stimulate a part for my sort of dorsiflexion, for bringing my foot up. We could stimulate the bicep, and so we could map out my body on the brain. Okay, and it's a very, very specific thing. It's pinpoint precise. But in people who have got chronic low back pain, what we see smudging of that homunculus. So, and this is borne out in functional MRIs, where you ask them to do a specific thing, and there's overlap between the part of the brain that does the low back and the tummy.
Right.
So they have lit the map on their brain of how to activate their muscles is smudged, and so the key point is there. They need to relearn. They need to engage their brain to relearn how to do that movement. And so you've got to be thinking about, well, what stops people learning? Fear of injury is a massive thing that stops people from learning. So
fear of pain, I guess, as well. If you've had previous
fear
issues.
of pain, yeah. I don't want to bend my back because it hurts is a great reason for you to forget how to bend your back.
Yeah.
So.
And thinking about bending backs and flexion, because there used to be, like, people are coming away from the fact that flexion isn't bad for the back.
Flexion is not bad at all. Inability to flex is bad.
So how do you convince your clients to flex?
Well,
and to keep moving?
First of all, you've got to start with talking it through so that people understand it. And actually, you can take a very practical viewpoint of this, and it makes sense. If you never flex your back, then clearly your back is going to be sensitive to flexion.
Yeah.
Okay, so it makes sense that if you never flex your back, what you should do is to start to flex your back. And the trick is actually doing that safely and in a way that doesn't flare you up. So you do a little bit first. And most people can do a little bit of flexion.
Yeah.
And then what you do is you build on that base. So you get them better at flexing rather than getting them better at the fear avoidant behaviour of bracing.
Yeah. So I've got quite a few Pilates clients that when we do back extension exercises, so kind of curling back, they'll say, well, I can't do that because I've got back.
Mm-hmm.
Whereas I think you've got to have that movement both ways, and quite often if you sit at a desk all day and you're in that sort of hunched position, to actually open up and extend through the spine is again quite a good thing.
Yeah.
But getting that through to people
Yeah.
that they can move.
So what you're describing there, I would describe as extension sensitivity.
Yeah.
So they are sensitive to extension, and exactly the same thing is true, that if you are sensitive to extension, the thing to do is to do a little bit first, and then to build up your ability to do that, because the idea of leading your life without doing that is just, you are setting up an injury at some stage in the future when you have to do extension. You know, there will be some event that you're not going to, you can't control every single movement in your life. People get bloody, when you think it through, there's no sense in it.
Yeah, and I guess the more you don't move, the more when you go down to pick something up off the floor, a kid's toy or something, then that is going to be when the back just goes.
Yeah, it just